Good morning. You're listening to Caregiver Crossing, a podcast brought to you by Joy's House. We're so blessed and thrilled that you're here. Caregiver Crossing is a podcast that's created just for you, the caregiver. And I'm Tina McIntosh.
And I am Terry Stacy, her friend, longtime friend. We've been doing this for a long time together, and we are here every week with you, with experts from across the country, providing comfort. We've got lots of great resources and, of course, joy to all of you caregivers. And the podcast really does serve to embrace family caregivers of today and tomorrow. We thank you all so much for being here. Let's jump right in, Tina. Do it.
Yeah. Today, we're talking with Shipman, who is the Director of Community Engagement at CarDon Associates. And if you're not familiar, CarDon has 20 communities owned, operated, and managed in the Midwest and more than 40 years of senior living experience. So they provide their residents with the best senior living options and personalized care, and they're good friends and supporters of Joy's House.
Yep, that's for sure. Kara is the Director of Community Engagement for CarDon Associates, and she's been with the company now for a little over a year. And what a year it has been. Kara, what a great time to start a new job. Kara started with the company in March 2020. Nothing like starting somewhere new right at the beginning of the pandemic, beginning and during the pandemic, and working with a very vulnerable population during this time. Let's start right here, Kara. Finally, we get to talk to you. How has CarDon worked successfully throughout this COVID-19 to keep residents and families and even yourselves safe?
Sure. Well, first, let me thank you guys for letting me be a part of this today. You guys have everything so well organized. I feel honored to be a part of this. But, that's a first great question. Keeping our residents safe, it was and it still is a huge priority. And, thinking back, we, just like everyone else, we didn't know exactly what we were dealing with so early on. But we did know that not only was it important to keep our residents as safe as possible, but it was almost just as important to keep them connected to their families. So much that we had an entire team of individuals that were dedicated to both, right? We ran them parallel, the safety and the connection of our residents. We ran them together. So just thinking back, and I was actually talking with one of our team members about this yesterday, but thinking back to the lengths that we went through to keep them safe while connecting them at the same time, it was heartwarming. It was gut-wrenching. Everyone was going through so much. But, to start with the safety. So we knew that one of the most important pieces was that we needed to be testing. Now, thinking about this, right? Think back. It is hard to imagine based on where we are today. But if you do think back, testing was hard to come by in the beginning, in the early on stages of this. And we knew that it was important because there were asymptomatic carriers out there. And that really drove the importance of testing and kept us on the forefront of being able to form the right partnerships early on to provide the testing. And we were able to test our associates vigorously. And we spent quite a bit of time on that. We have an individual on our team that was dedicated, and he worked tirelessly to make sure that we had the right contracts in place for not only testing, but, adequate PPE, all the supplies that we needed to keep residents and staff safe. And in the way of staying connected, again, thinking back is kind of crazy, but we were doing everything we could. It was an all hands on deck sort of approach. We were doing window visits. We were doing parades around the building that were inclusive of city officials, fire departments. We had signs going out. We were sanitizing every single item that was coming in through our doors to be delivered to the family members. We were sanitizing them. We were providing video calls. So anything and everything that we could do to help the mental health of our residents and then keep them connected at the same time.
So, Kara, I appreciate the insight because, we see what we see on the media and the clips, and it is the heartbreaking stuff, right? And the hard stuff, but y'all have done so much work to take care of every single individual. Now that we're in this shadow of a pandemic time, how is it different? And what are the efforts now?
Yeah. So, great question. The efforts now are, we are spending time on working really hard and doing a multitude of campaigns surrounding the importance of vaccines, right? You think about where we started and where we've come around, right? Concentrating on the safety of our residents, while still important, also just as important today, again, piggybacking off the safety, is making sure that people are getting their vaccines, our residents, our staff, our family members. We're encouraging everyone in essentially our community to get the vaccine. So in this, we're putting out a lot of education to our staff, to our residents and family members. We're putting out personal stories of what we are calling it's our why, right? Our personal story of why we are getting the vaccine. And at the end of the day, this has really allowed us to allow family members back in and prospective residents back in. And it's been fantastic to see this come back around. So, in today's world, in today's senior living environment, we're truly concentrating on moving forward while, again, keeping an eye towards continuing to stay safe and then encouraging the vaccination.
Our guest today on Caregiver Crossing is Kara Shipman. She is the Director of Community Engagement for CarDon Associates. Been with the company now for about a year during this time of pandemic. And I remember, Kara, in the beginning, a lot of families wanted to get their loved ones out of communities because that's where we were seeing so much of COVID and death, quite frankly. And it was a scary time. A lot of families want to get their families' loved ones out of there. But now, most of the communities have had they're fully vaccinated and are saying, this is one of the safest places your loved one can be right now. So going forward during this time we've seen some light at the end of the tunnel now with vaccinations and the numbers of people getting vaccinated. So your advice to those that are thinking maybe this is the time to put mom or dad or grandma, grandpa in a community.
Sure. Yeah. My advice for that, and let me just echo some of what you just said. It is right now, our communities can be the safest places for your family members and your loved ones to be. And, throughout the pandemic, part of our goal was to understand what our residents were going through. We can assume, right? If you think about what we were all doing during that time, we were all in quarantine at home with our families, with our loved ones, with our pets, with someone, right? And we could assume how hard it was for our seniors at the time, but we wanted to actually learn from them at the time so that as we move forward, we can make sure that we are, working on the right things to make sure our residents are happy. And surprisingly, what we kept hearing, we did focus groups of our residents and we asked them questions. How did you feel? How do you feel during the middle of this pandemic right now in quarantine? And surprisingly, what we kept hearing was, I feel safer here than I do at home. I feel like I don't have to worry about going out to the grocery store. I don't have to worry about going and doing my errands and being exposed to the public. But at the same time, I still have my sense of community with my friends that are here in this community with me. Even the nurses are now becoming family members. So, it's been great to be able to see our residents during this pandemic still feel that sense of safety and security and community at one of the scariest times that's going on in the world. So today, as I would, advice for people who are considering, something that I would really encourage you to do is to think about it earlier than you may think is necessary. Something that we have seen during the pandemic, post-pandemic, I guess I should say, is people are coming to us with a higher acuity level. They're coming to us sicker than they used to pre-pandemic because they've been isolated in their homes for a year and their mental state and physical state has declined. So I would encourage you to keep an eye on your family members, look for the small things. Do they need some help with activities of daily living? Do they need some help with medication reminders? Small things. Are they feeling socially isolated at home and would they benefit from a sense of community? I would just encourage you to think about those things a little bit earlier than you may feel necessary and move mom or dad or a loved one early enough so that they can enjoy the sense of community and the socialization that they will get from a community.
Tina, I know we just have a minute or two left. You want to go ahead and wrap it up for us. Unfortunately, the time has come to an end. It goes by so fast.
It's too fast.
Yeah.
My biggest question now is, can people just walk in, or should they call to schedule a tour and to go through kind of an assessment on the phone?
Yeah, good question. So yes, they can walk in. We would prefer for people to call just so that we can be prepared and make sure that we have that time set aside and we're ready and prepared. But we're not going to turn away visitors or family members that come to the door.
Excellent. And a website?
Yeah. So www.cardon.us is the best way to find us. While you're there, I would encourage you to check out something we have that we call a rubric. It's an assessment to basically give you a health assessment of where you are today. No commitment necessary. It spits out essentially what's called a care fit report. My favorite part about this report is it gives you a first person narrative of your own story in your own words to give you a better understanding of where you are today as far as your health is concerned. So, and then give you an idea of what may be a good option for you as far as healthcare. So that would be at cardon.us/rubric.
Kara Shipman, you are just terrific. I think you found a good home for yourself at CarDon, and I know that they are really grateful to have you on board with them. Kara Shipman, as we said, Director of Community Engagement for CarDon and Associates. Tina?
I just, as we're closing here, I want to remind people that you can contact me at tina@joyshouse.org if you have anything you'd like to hear on the show or anything to share. And also, we're really thrilled to share that Caregiver Crossing is supported by our friends at AARP. So they are leading a revolution in the way people view and live life after 50. And we're so thrilled that they've come on board to support not just the podcast, but Joy's House in general. So we love the work they're doing. They are empowering people to choose how they live life as they age. So thanks to them. And thanks, Kara, for joining us here on Caregiver Crossing. For the rest of you, we will see you next week.
Thank you, guys.